Okay, let's unpack this. Today, we are diving deep into a topic that affects, well, every single one of us. Healthcare quality and patient safety.
Absolutely. It's fundamental.
And we've got a fascinating stack of sources here. They really take us from the highest levels of global
All the
standards.
way down to the practical steps you can take in your own healthcare journey.
Exactly. So, our source material for this deep dive includes info about big international players like Joint Commission International.
JCI, yeah. And insights into regional efforts, too, like India's National Accreditation Board for Hospitals and Healthcare Providers, NABH.
Right. And then there's some really practical guidance from a consultancy firm, Medic.
And that includes some absolutely critical advice, stuff we all need to hear about preparing for medical tests.
So our mission here is pretty clear.
Yeah.
Pull out the essential nuggets from these sources. What do they tell us about the system, the big picture of ensuring quality care?
And maybe even more importantly, what do they tell us about your vital role as a patient? How you fit into getting the best possible health outcomes.
Okay.
Let's jump in.
So where do we start? Well, our sources point first to the international stage. They really highlight Joint Commission International, JCI, as a major force.
A global leader, basically, in healthcare quality and patient
Well,
safety.
that's the idea, and they are everywhere.
I saw that. Operating in over 70 countries.
Yeah, across Asia, Europe, the Middle East, Africa, Latin America. It's extensive.
And they've accredited over 1,000 programs with support from, 600 plus experts?
That's right. Their mission, as the sources stated, is to enable and affirm the highest standards of healthcare quality and patient safety for all. Pretty ambitious.
It is. So what's fascinating is how they aim to do that.
Well, it seems to be through developing really rigorous international standards, like top-tier benchmarks.
And then using a detailed evaluation process.
Exactly, to help organizations measure, assess, and, continuously improve their performance. It's not a one-and-done thing. Makes sense. And a key part of this is their international patient safety goals, right?
Yes. And these aren't just abstract ideas. The sources indicate they target things that have historically been, tricky spots in patient care.
Like making sure the right patient gets the right medication.
Precisely. Or preventing infections, improving communication among caregivers, things like that.
So they're aiming at very real, tangible risks.
Definitely. It sounds intense, the whole process.
And the sources share some perspectives, some anecdotes from hospitals that have gone through it.
Oh, yeah? Like what?
Well, one CEO mentioned it was one of the most effective team-building exercises they'd ever done.
Team building. Through accreditation. That's interesting.
Yeah, specifically calling out enhanced communication and coordination. Think about that accreditation actually forcing different departments to talk and work together better.
Huh. I can see that. Breaking down silos.
And another quote, this one from a quality officer, highlighted the competitive edge it gives them.
Boost community confidence, I imagine.
Exactly. And significantly improving risk management. It helps hospitals really organize their patient safety efforts.
Embedding a culture of safety, is that the idea?
That's what it sounds like, prioritizing it at every level.
It really points towards JCI's overall vision, which the sources mention, zero harm.
And highly reliable care. Ambitious goals.
Definitely. And they're apparently working on new initiatives to push towards this. Things like patient safety pathways.
Evolving their accreditation model, looking at sustainability in healthcare.
And updating their core standards, too. The 8th edition for hospitals was mentioned.
So it shows it's a constantly evolving effort, not static.
Right. So you have that global benchmark being set by JCI.
Yeah.
Now, if we kind of zoom in regionally, say on India.
Then our sources introduce the National Accreditation Board for Hospitals and Healthcare Providers, NABH.
And NABH plays a similar, really crucial role, but specifically within India.
It's part of the Quality Council of India, QCI.
That's right, a constituent board. And their job is to establish and run accreditation programs just for healthcare organizations in India.
Covering everything from big hospitals down to diagnostic centers.
Yep, a whole spectrum.
And their purpose sounds like it echoes JCI's, but with that national focus.
Exactly, catering to consumer needs, setting those industry-wide benchmarks within India.
And basically creating that ecosystem for quality healthcare in the country.
And the standards themselves, the accreditation process, those are the tools, the resources they provide to achieve this.
Okay, so you have these big standard-setting bodies, global and regional.
Right. But, standards on paper are one thing.
Putting them into practice in a busy hospital, day in, day out, that's another challenge entirely.
It really is. Which raises a key question. How do hospital owners and operators actually translate these complex standards into into reality.
Into the day-to-day running of a high-quality facility.
Yeah.
And this is where the sources bring in organizations like Supreme Medic Consultancy.
The practical side.
Exactly. They act as partners for hospital owners, helping them navigate this exact challenge.
Their role, based on the material, seems pretty comprehensive, like end-to-end support.
It sounds like it. From the initial idea and planning phases, all the way through getting accredited and managing ongoing operations.
Okay, so looking at the range of services they offer, the list mentioned in the sources gives us a good insight into how much operational work goes into quality.
It's definitely not just about the clinical care side of things.
No, not at all. It includes things like planning and designing the actual hospital layout.
Which makes sense. Efficient design impacts patient flow, safety.
Right. And then there's recruitment, making sure you have the right doctors, the right nurses in place. Critical.
Absolutely. And then they get into the core quality systems themselves.
Explicitly mentioning support for getting that NABH accreditation we just talked about.
And also NABL accreditation, that's the one specific to medical testing labs, right?
Yeah, crucial for accurate diagnostics, which we'll definitely talk more about later.
And they also help with the nitty-gritty of hospital operations management.
Like setting up standard operating procedures, SOPs.
Exactly. Those step-by-step guides for how things should be done consistently, from patient admission to surgical checklists, everything.
Consistency is key for quality. They also help analyze capacity.
Restructure departments for efficiency, implement hospital information systems.
The HIS, the hospital's digital brain, basically.
Pretty much, yeah. Managing everything from appointments to patient records.
It just shows that achieving quality isn't only about clinical guidelines. It's so deeply embedded in the structure and efficiency of the whole place.
Totally. And they even help with sourcing and installing medical equipment and infrastructure.
Like setting up modular operating theaters or medical gas pipeline systems.
Yeah. All those practical, physical elements have to be right to support quality care. It's foundational.
And the sources also hint at their involvement in the broader healthcare investment scene, helping businesses strategize.
Right, and related initiatives like HospiMatch seem to show how interconnected the whole healthcare business is.
Touching on everything from financing and chronic disease management
to patient care trends, specialized senior care, mental health. It's vast.
It really underscores that behind the direct care you receive, there's this huge, complex business structure that needs to function well for quality to happen.
Absolutely. So, okay. We've got the global standards, the regional frameworks,
and the operational expertise helping hospitals put it all into practice.
But while all that system-level work is happening, there's a point where quality and safety are directly impacted by, well, by you, the patient.
This is where it gets really practical, really personal.
Yeah. Our sources make it crystal clear that one of the most significant ways you, as a patient, directly influence the quality of your own care
is by simply following instructions before medical tests. Seems simple, but it's huge.
It really is. There's a quote in the sources that just jumps out.
Which one?
Most test errors happen before the lab even sees your sample. The right preparation is half the job done.
Wow. Half the job done before the lab gets it. That's powerful.
It reframes things, doesn't it? It's not always an issue in the lab. Often it's something preventable that happens beforehand.
And the impact of not preparing correctly is massive. First off, accuracy.
Right. The primary reason for instructions is ensuring accurate, reliable results. If you don't follow them, like eating before a fasting test.
Whatever you ate can completely skew the numbers, throw things off.
And incorrect results, well, they can lead to a wrong diagnosis.
Or the wrong treatment plan.
Yeah.
Which is obviously potentially dangerous.
Definitely. And beyond the accuracy issue, incorrect prep just causes unnecessary delays.
Yeah, you might show up, find out you weren't prepared properly.
And the test has to be rescheduled. That's wasted time for you, potentially wasted money.
And a delay in getting the information your doctor needs for your care. Frustrating for everyone.
So the sources highlight several really common mistakes people make that don'ts, and crucially, how to avoid them.
Okay, let's walk through some of the big ones. First up, probably the most common.
Don't skip fasting.
Yes. For tests like a lipid profile or fasting blood sugar, you absolutely need to avoid any food or drink.
Except plain water.
Except plain water, yeah, for typically 8 to 12 hours before the test.
And even a tiny snack or a sugary drink can mess things up.
Completely. It could throw off critical values. The fix is simple, but, it requires discipline. Stick to that fasting window strictly.
Okay. Next is one people might not even think about.
Which is,
Don't skip water before certain ultrasounds.
right, like pelvic or abdominal ultrasound.
Exactly. The technician often needs you to have a full bladder for clear visibility.
So if you show up without drinking enough water, they might not get a good image.
Right. The sources advise drinking maybe 4 to 5 glasses about an hour before.
And not going to the bathroom unless they tell you to. Hold it.
Basically, yeah. Okay, another really important one for accuracy.
Don't take or skip medication without confirming.
This one feels critical. Many medications can interfere with blood or urine test results.
And you can't just guess which ones are okay or not.
Absolutely not. You must ask your doctor or the lab staff specifically which medications to take or stop before your test.
And this is especially vital for, like, life-sustaining meds, heart conditions, thyroid issues.
Never stop those without explicit medical advice. That seems like a huge warning.
It is.
Mhm.
Okay, what about sample collection? Another area prone to error.
For sure. Don't use unclean containers or do poor sample collection.
Always use the sterile containers the lab provides. Don't grab something from home.
Right. And for things like urine, follow the instructions for a midstream collection. Helps avoid contamination.
Proper labeling, too, obviously. And getting the sample to the lab quickly.
Usually within 30-60 minutes, the sources suggest for stability.
And for women, letting the lab know if you're menstruating when giving a urine sample, that's important context.
Good point. Because contaminants or delays can lead to false results.
Okay, moving on to imaging. MRI or CT scans.
Big one here. Don't wear metal.
Obvious, maybe, but crucial. MRI machines use incredibly powerful magnets.
Metal objects can become dangerous projectiles or just badly distort the images.
So simple, metal-free clothing. Remove all the jewelry, hairpins, anything with zippers or metal buttons.
And always tell the staff if you have any internal metal. Implants, pacemakers, pins, they need to know.
Absolutely critical. Okay, the last big pitfall the sources really emphasize.
Don't lack clarity.
Meaning don't just assume, or rely on something you found online, maybe.
Exactly. Every test, every lab might have slightly different requirements. Don't wing it.
So ask. Ask the lab or your doctor for specific, detailed instructions for each test you need.
Preferably get them in writing or take detailed notes. And do it a day or two before, not last minute.
Yeah, so you aren't scrambling. It avoids missing some critical step that could just invalidate the whole test.
Such a waste if that happens.
Totally. And the sources even give you a really handy tool, a list of 7 smart questions to ask before a test.
Oh, useful. Let's hear them.
Okay. Number 1, do I need to fast?
Basic, but essential.
2, can I drink water or take my medicine?
Covers those points we just discussed.
3, should I come with a full bladder?
For those ultrasounds, yeah.
4, do I need someone to accompany me? Good logistical question.
True, especially if there's sedation involved or something.
5, what time should I arrive? Avoids rushing.
6, can I eat after the test? People always want to know that.
And 7, when and how will I get the report? Manages expectations.
Asking those 7 questions seems like it would cover most bases. Should significantly reduce the chance of error.
Definitely seems like a good checklist.
And just for quick reference, they did mention some key tests again.
Right, like blood sugar and lipid profile usually need that 8-12-hour fast.
Pelvic ultrasound often requires a full bladder.
Urine tests typically need a morning sample, collected cleanly.
MRI means absolutely no metal allowed, period.
CT, with contrast, might need fasting, and checking for allergies or kidney issues needs confirmation.
And tests like thyroid function, vitamin D, or a CBC, that's a complete blood count.
Usually don't require fasting,
Yeah.
but the advice is always confirm. Double check with the lab beforehand. Don't assume.
That seems to be the mantra. Don't assume. Ask.
Yeah. And the potential costs of not getting this right,
Yeah.
they go beyond just the test itself,
We touched on it, but wrong prep leads to wrong results.
which can lead to wrong or delayed treatment. That's the big danger.
Plus, you might have to repeat the test. More time, more money.
And yeah, insurance might not cover a repeat if it's clearly due to patient preparation error. Ouch! The sources were pretty blunt here. One quote, lab reports guide your treatment. Give them the respect they deserve. Prepare wisely.
That puts it starkly. Another one was testing is teamwork. Your role is just as vital as the lab's.
That teamwork idea is really powerful, I think.
It is. It shifts the perspective. You're not just a passive recipient of care. You're an active, essential member of your own healthcare team, especially for diagnostics.
And simple steps, like you said, writing down instructions, setting reminders on your phone.
Calling back if you're unsure, These can literally change the outcome.
Absolutely. But, as the sources also point out, this responsibility isn't just on the patient.
Right. Healthcare providers have a huge role to play, too.
A vital role in preventing these pre-test mistakes by making sure their communication is clear and effective.
And that means more than just, like, handing over a standard sheet of paper.
Right. It's about explaining why a test is needed, first off, in simple terms.
Giving step-by-step instructions in language the patient actually understands, maybe using diagrams or visuals.
Yeah, whatever helps. Providing clear written instructions is still crucial, though.
And actively encouraging patients to ask questions, creating that space.
And taking the time to answer them thoroughly, not rushing.
Having standardized protocols and up-to-date education materials helps too, right? Ensures consistency.
Definitely. And providers also need to think about potential barriers a patient might face.
Like language differences, literacy levels.
Or just specific individual needs. And maybe offering reminders or follow-up calls if necessary.
And the sources also mentioned interprofessional collaboration.
Meaning the whole team working together.
Yeah, from the doctor ordering the test, to the nurse giving instructions, to the lab receiving the sample, everyone needs to be on the same page.
Sharing details, using tools like electronic health records, EHRs, to track instructions.
It all contributes to the patient getting the right information consistently.
So these provider efforts are essential partners to the patient's own diligence. It takes both sides.
To achieve those accurate diagnostic results makes total sense.
So thinking about this whole deep dive, kind of pulling it all together, what have we really learned?
Well, we've seen the layers, haven't we? From the global organizations like JCI setting that gold standard.
The regional bodies like NABH applying those standards in specific countries.
The crucial role of consultancies like Supermedic in helping hospitals actually implement these complex systems in their day-to-day work.
And critically, how all of that system-level effort really converges on the individual patient. Where your actions,
like following pre-test instructions,
yeah,
become an absolutely vital component, ensuring quality and accuracy in your own healthcare journey.
It's a complex ecosystem, isn't it?
It really is. And achieving quality healthcare truly is a team effort. Every single piece matters.
The international standards, the hospital operations, the provider's communication.
And yes, your personal preparation, it all links together.
And here's that final thought from the sources, something for you, the listener, to really take away.
What is it?
Don't let a careless mistake turn into a medical delay. When it comes to diagnostic tests, preparation is prevention.
Preparation is prevention. Powerful. Well, thank you for joining us for this deep dive.
We really hope this gives you a clearer picture of all the forces working behind the scenes to ensure healthcare quality.
And maybe empowers you with some practical steps you can take next time you need a diagnostic test to ensure accuracy for yourself.
Until next time.